Welcome to the Compounding Center Connections, where we talk about different health conditions with our partnered practitioners. I'm your host, Jay Gill, a compounding pharmacist from the Compounding Center in Leesburg, Virginia. At the Compounding Center, we collaborate with practitioners, create custom medications to help our patients get better. So in today's episode, we have Araceli Benavides, a functional and integrative nutritionist at the Capital Integrative Health in DC. So Araceli, I know I had seen your presentation on SIBO a couple months ago and wanted to have you join us. And thank you for joining us so you could kind of share your presentation on SIBO to our listeners. So thank you for being here.
Thank you, Jay. This is a pleasure for me. I really like and enjoy working with patients with SIBO, so I like to share a little more of the information and work that we do.
Awesome. So before we dive into it, I just want to give a little disclaimer that, the information discussed today is purely for informational purposes only, not for diagnosis or treatment. And so you have some slides to share with us, and we'll make sure these slides, for those of you that are listening to us on a podcast platform, that we have the link to these slides in the show notes. So let's get started. I'll turn it over to you, Araceli.
Great. Thank you so much, Jay. So we'll talk a little bit about what is SIBO, what symptoms this causes, why do we get SIBO in the first place, what are different types of SIBO, and how can we address these using diet, antimicrobials, or sometimes there's need for antibiotics. And I would highly recommend to see your provider for this. This is only educational, but it's definitely interesting to know the many different ways that we have to address SIBO.
So Araceli, I just remembered how wrong of me. I didn't even give you a chance to introduce yourself. I totally skipped over that. Gosh, can we back up and just please introduce yourself to the listeners and viewers?
Yes, of course, my pleasure. So I'm a nutritionist and I'm certified functional medicine certified practitioner through the IFM, and I've been working at Capital Integrative Health for 3.5 years now. So, and I did my master's also in integrative medicine. Mm-hmm.
Okay, thank you. All right.
Sure. So then, so what is SIBO? That's the main first question. So SIBO stands for Small Intestinal Bacterial Overgrowth. So one important thing to know is that it's totally normal for us to have bacteria in our large intestine, but we want about 99% of our bacteria to be located in our large intestine. But when we start to have bacteria overgrowing in our small intestine, that's what starts to create digestive discomfort. So these bacteria being located in the wrong place starts to ferment different fibers from our food, and it can produce different gases. It could be hydrogen, methane, or hydrogen sulfide, which we'll talk more in just a little bit. And those gases present in the small intestine can be really problematic for our digestion. So that's basically what SIBO means. It's just the overgrowth of bacteria in the wrong place, in the small intestine rather than the large intestine. So it's important to make that differentiation, since having bacteria and good bacteria in our large intestine is really good for us. And then, so when we talk about the percentage of people that experience SIBO or that might, a lot of people have undiagnosed cases of SIBO, and research have shown that about 60 to 80% of all patients experiencing irritable bowel syndrome, it can be attributed to SIBO. So we see it's a large percentage. So this is what typically is causing those irregularity of the bowel movements and gas and bloating, and patients don't really understand why, if it's a food sensitivity or an intolerance. And sometimes, a lot of the times, we see that it is due to SIBO. And that's why it's very important to test and address this. So when we think about symptoms and what patients experience when they have SIBO, it is a wide variety of symptoms. Some of them can be related to digestion because it could be presented as bloating and gas, abdominal pain. Those are very common symptoms of SIBO. And we also see patients experiencing diarrhea, especially mostly with patients that have hydrogen SIBO, they tend to experience diarrhea. And for patients with methane SIBO or methanogen overgrowth, they experience more constipation. So that's one thing that tends to differentiate the type of SIBO. But other than GI symptoms, we can also see that patients feel more fatigued because SIBO also lead to malabsorption of nutrients. So we don't absorb well on nutrients, we get more fatigue. It can also affect our immune system and lead to eczema or rashes, rosacea, different expressions through the skin. It can also increase inflammation and lead to migraines, anxiety, depression, so mood swings, and also even affect our respiratory tract and experience asthma. So it definitely can affect almost all areas of our body, especially patients with hydrogen sulfide. This gas is very toxic to our mitochondria and to our nerves. So some patients also experience bladder pain, or even tingling and body aches. So that's a newer area of SIBO that they're researching more, but that can also be present. So just a lot of symptoms to watch out. And Jay, please feel free if you have any questions or anything, let me know.
Okay, I will.
Great. So a big question is, why do we get SIBO in the first place, right? So why so many patients experiencing SIBO and suffering from SIBO? So a really big area on why this happens is impaired motility, and we see it here in the slides. So we can get impaired motility, meaning that our gut is contracting slowly, so we don't move foods along properly, and then they stay in our small intestine longer, and it causes this fermentation there, where bacteria would overgrow. Think of it as a stagnant swamp. If the water is not moving and the water is like stagnant, then more bacteria is gonna grow there. And we don't necessarily want that. Our gut have our mechanism called migratory motor complex that every 3 hours that we're not eating, it contracts and it cleans up any waste products, anything that is left, it sort of gets cleaned up every 3 hours that we're not eating. And that's why you're going to hear further down that we recommend meal spacing when we experience SIBO, so that this cleaning mechanism occur. But when this cleaning mechanism is not happening properly and we're like getting this food just sort of sitting in our small intestine for too long, it starts to create more overgrowth of bacteria just by staying in the wrong place too long. And this can happen because of having low thyroid, which is very common. And I'm sure, Jay, you might do a lot of like compounding for thyroid medications as well. So having low thyroid is a root cause for this, and also history of food poisoning. It disrupts those proteins that are in charge of that motility and movement in our gut. So we always, for my SIBO patients, I always ask, like, do you have any history of food poisoning? And we also check their thyroid, because those can be underlying causes. So that big piece of motility. And other things that can impact the motility are medications. So the use of steroids, for example, and also if they have like a history of chronic antibiotics, chronic use of antibiotics that also wipes out the good bacteria, and then it can lead to more overgrowth of pathogenic bacteria or just bacteria that can cause more issues in the gut. So medications can also be another root cause for SIBO, with the antibiotics, the steroids, or the PPIs or acid blockers. It just blocks that acid in our stomach, which typically serves as a barrier to kill off bacteria. So when we're eating, our mouth has a lot of bacteria. Some of the food that we eat can have bacteria. When we swallow, we want the acid to kill off bacteria that is coming in. But if we're blocking that acid suppression, it can lead to our small intestine and increase the chances of SIBO. So that's the other area. And then other areas could be if you have any history of trauma to the abdominal area, and there's certain like scar tissues that get produced, or basically adhesions or scar tissues that don't allow the motility in the gut to go smoothly, that can also lead to further growth of bacteria in the small intestine. And last but not least, if we have low stomach acid or low digestive enzymes because we have poor diet or we're stressed all the time, that can also affect the way that we're digesting food and increase chances of SIBO. Any question on your end, Jay? Everything clear there?
No, everything is clear, very, very concise, and I this is the second time listening to it, and I'm even grasping more. So please continue.
Okay, awesome, great. So let's dive more into these three areas of SIBO. So now we heard about like why we get SIBO, and then like how can these be presented in three, it can cause three different types of SIBO. So the first one could be hydrogen SIBO. So as I mentioned, it could be related to diarrhea, and there's common bacteria that can cause this type of SIBO, like Klebsiella, E. coli, Proteus, and Aeromonas. And but the other symptoms can be the same. It can still present bloating and gas and everything, but typically more diarrhea. So that's more for hydrogen SIBO. And then we can also have methane, which is mostly related to constipation, because methane is a gas that is considered a local paralytic. So it would even slow down further our motility. It can also be associated with weight gain. And when we have methane, like methane as a molecular, like chemical structure, it's one carbon molecule with four hydrogens. So sometimes that hydrogen gas is used to produce methane. That's a little bit more of a complicated interchangeable thing with hydrogen and methane, but basically when we have more methane, we experience constipation and a lot of the times like weight gain, and it can be caused by a bacteria called M. smithii as well. And the last type of SIBO that has been researched is hydrogen sulfide. And this is very characteristic. Most patients experience sulfur-smelling gas, or what patients sometimes refer as rotten egg smell. And that's very characteristic of hydrogen sulfide. And it has also been associated with inflammatory bowel disease, like Crohn's, or ulcerative colitis. So both of those can, like hydrogen sulfide can increase the risk of IBD, or in IBD patients it's more common to see hydrogen sulfide SIBO. And depending on the type of test that you use, most common tests can test for hydrogen or methane. And if we see a flat line on the test, just zero throughout the whole test, it might imply hydrogen sulfide. But now there's a new test called TrioSmart that can test for hydrogen, methane, and hydrogen sulfide. So if we're suspecting that there's hydrogen sulfide, we would use this type of test as well.
I was just going to ask you if someone listening to us says, "Gosh, I have all the symptoms," and so is there a test that you can also use to match with the symptoms that they have SIBO, or one of the three, or can somebody have all three of the types of SIBO?
You can have all three, like you can have mixed SIBO. It's rare because typically when they have methane, the hydrogen has been used up to make methane. And when they have hydrogen sulfide, the hydrogen has been converted to hydrogen sulfide. But there are cases where you do see both gases, or the three gases elevated. I've seen hydrogen and methane both elevated a lot of the times at the same time. I've never seen the three of them. But it could be possible. So when we're not sure like what's going on and we suspect that hydrogen sulfide might be present, I do recommend doing the TrioSmart. It's a specific lab. It's the only one that tests for the three gases at the same time. But yeah, that's a great question. You could have a lot of the patients say, I have irregular bowel movements, like I have diarrhea and then constipation and then diarrhea back and then sort of all over the place. So yeah, it totally can be that there's both being an issue.
And Araceli, SIBO can take place in any age group, right? It's
Yes.
not necessarily later in life or anything like that.
No, definitely.
Okay.
We see at CIH, we see patients 12 and up, but
Wow.
I have seen a lot of like 13, like a lot of teenagers with SIBO as well. So yeah, it can happen early in life, and it can happen even younger. I just don't see them because we don't see kids in the office, but yeah, it can happen at any point.
Okay.
Yes. So I'll now go through some of the general treatment guidelines that we use when treating SIBO. So there's different levels of gas. So these tests, the unit that they use is part per million. And there's different levels depending on if it's hydrogen methane or hydrogen sulfide of the threshold to be considered positive. But when we're thinking of treatment, we want to lower every 30 parts per million of gas. And typically 2 weeks of antibiotics would lower 30 parts per million, or 4 weeks of herbals would lower 30 parts per million of gas. This is very general, like that's an approximate. Not everyone responds to the treatment the same way, but that's what like the general like guidelines that we use, and then we evaluate how the patient is feeling, and if we need to do more, we can, or then we retest. So I'll put an example of a patient. Let's say we have a patient with a hydrogen level of 60 parts per million. They would say, we know we need at least 2 rounds of treatment, and we can choose to combine antibiotics and herbs or only herbs. I typically, if it's more than 1 round, I try not to do 2 rounds of antibiotics if possible. So I try to use antibiotics and herbs, or just herbs, or elemental diet, which is basically a shake, which I'll talk in a little bit, because you can lower further the levels.
Is there a goal to reduce the gas parts per million to 0, or is it just trying to keep it below a certain number because you always have some sort of gas, right?
Right, exactly.
Some amount.
Lower than the threshold, which is around like less than 20 parts per million, or less than 10 parts per million. And yeah, so you want to keep it below the threshold, and you want to keep it below the threshold for the small intestine. Then if it passes the threshold during the large intestine portion of the test, that's totally normal, and that can happen. But yes, so that's a great question. So we want to keep it at the minimum, but it doesn't have to be 0 throughout the whole small intestine. And so basically what we see for most of the patients, if they're treating with just herbs, they typically need around 12 weeks of treatment, and we might take some breaks in between if needed. That's sort of like very individualized depending on like how they're feeling and how much progress they're doing. And when we use herbals, we match it with a low FODMAP diet or SED, because I'm gonna dive a little more specific into the FODMAP diet in just a bit, but it's basically trying to reduce the food that the bacteria like to eat. So it's not that because it's bad food or it's like unhealthy for us, it's just that those bacteria really like to feed on the FODMAPs, and that causes more gas and more fermentation. So we try to lower that so that we don't feed the bacteria while we're treating with the herbs, and that can help the improvement of symptoms accelerate a little more. After we treat the SIBO effectively, we typically use prokinetics to make sure that we address the motility. The prokinetics are basically agents that help our gut to contract. It could be either herbals, or it could be pharmaceuticals. You can go either way. There's ways to compound different like prokinetics, which if we're interested, we can talk more about that as well. But basically we follow after treating SIBO effectively, the patient is feeling good, negative test, we do 6 months of prokinetics afterwards to make sure we don't get relapse of SIBO, because it's very easy to get like treated and then get it again if we don't address the root cause. So if the motility is not optimized, then we get it again. And then we can consider retesting. That's very like up to the patient and their practitioner. And protocols this is something very important to mention. Protocols will vary patient to patient. So there are certain like general things that we'll mention in just a bit that is good for hydrogen methane and hydrogen sulfide, but it depends on how each patient responds to the treatment, how much or how little we need to treat. So this is a very common question that I hear from patients, like what's a realistic treatment timeline? Because everyone wants to know like how long it's going to take to resolve. But one important thing to know is SIBO can be developed over many years of like the motility not working properly, digestion not working properly. So we definitely need to address the root cause, and that can take longer than just those rounds of antibiotics or herbals that we just mentioned. So we see that most patients take like working on their gut health and totally recovering like around 6 months to a year. But they might be feeling better like in a shorter period of time, but to totally say, okay, we don't have to worry about SIBO anymore, and like you're totally feeling better and stable, it might take that long. And definitely certain like maintenance habits need to be ongoing to just make sure we don't get like relapses of SIBO. And of course, this doesn't mean that they will be on antimicrobials or antibiotics for a whole like year. No, but definitely different things that we would do to help their gut heal. So it is important to touch as well that patients might experience die-off symptoms. So when we start to kill off these bacteria contain a lot of toxins inside them. So when they start to die, they release a lot of toxins that can get into our system, and it can cause headaches or fatigue or worsening of their GI symptoms before they feel better, brain fog, acne, like breakouts of acne, weight loss, muscle aches, different things that patients might experience in the first 1 or 2 weeks. To try to minimize the die-off, we always recommend patients to stay really well hydrated and to ramp up the dosages. So depending of not so much with the antibiotics, but with the herbals, we start lower and then we build up to a full dose so that when bacteria start to die, they don't release a lot of toxins at the same time and they don't cause a lot of die-off. So patients don't feel too sick at the beginning. But this is something that can happen. Great. So that's
how do you just I think you just jumped to this question I had. How do you decide between herbal treatment or antimicrobial treatment? But I'll let you continue because I think you're getting to it.
Yes, I'll definitely talk about that. So the like how to decide between one or the other, I definitely always ask patients first, like what they feel more comfortable doing. Definitely when we talk about rifaximin, it's a very localized, targeted antibiotic for the small intestine and works really well for hydrogen SIBO. So if patients have only hydrogen and no methane, and they feel comfortable doing an antibiotic, I always talk about the pros and the cons and what other effects the antibiotics might have or not. But rifaximin is localized to the small intestine. It's considered an eubiotic because it doesn't affect the large intestine. Bacteria doesn't like kill off necessarily good bacteria in the large intestine, and it doesn't get absorbed systemically. So it's sort of like tends to be very safe and works really well for patients experiencing diarrhea and that have hydrogen. If I have a patient with diarrhea and hydrogen only, I would definitely try to recommend rifaximin, and if they're comfortable, I would do that for sure. If we have a patient that has methane, we would have to combine rifaximin with either neomycin, augmentin, or flagyl. And when we start to do combinations, those other antibiotics can be absorbed systemically. They can affect the large intestine bacteria. They can have more side effects. Neomycin can cause some ringing in the ears for some patients. So I try to discuss like other effects that can happen with other combination of antibiotics. And I would only, if the patient feels comfortable with it, I could recommend that, of course, through their medical provider to prescribe it. But I try to lean more towards herbs if we're dealing with methane SIBO or hydrogen sulfide SIBO. That's sort of like the way that I decide like one way or the other. Does that make sense? Like
Yeah.
Totally. Okay, great. And typically I would say that the antibiotic rounds for 2 weeks, and if we need further treatment, switching to herbals if needed. And here are for patient listeners that are seeing the slides, here are the different options of the antibiotics that we use that I mentioned before, with only rifaximin for hydrogen or combination of rifaximin and metronidazole or neomycin for methane SIBO.
I just want to add in right now, Neomycin is on a nationwide recall. So if it's unavailable at your local pharmacy, please reach out to your local compounder because compounders can temporarily compound it until it's back on the market.
Oh, that's good to know. Thanks. That's great. So, yes, so then if we talk about antimicrobial herbs, so here we also need to decide what we're going to use depending on the type of SIBO that the patient has and also what symptoms they have. So we think of when we have hydrogen SIBO and patients are experiencing more diarrhea, we always have to combine like at least two different antimicrobial herbs. And we think of Berberine, Oregano, and Neem, and choosing two out of those three when we have hydrogen SIBO. And there's also certain brands like Metagenics that have like a combination, like Candibactin AR that has oil of oregano, but other aromatic herbs as well, and Candibactin BR that has berberine and other aromatic herbs. So you can use also other herbs in combination, but definitely you want to mix berberine, oregano, neem, like two of those at least. So that's hydrogen. And then if we have methane, we want to make sure that if the patient tolerates it, that we use allicin, which is the antimicrobial component of garlic. And they can combine, so we choose allicin for sure, and then we combine it with either berberine, oregano, neem. So you choose one of those in combination with allicin. And then if we have patients with hydrogen sulfide, we want to choose uva orsi. Most of the times, that's the one that we would choose for hydrogen sulfide, and I would combine it with oregano. Oregano and uva orsi would be my go-to for hydrogen sulfide, and I would use bismuth as a biofilm disruptor because we definitely use biofilm breakers, which I'll talk in a second when we're treating with herbs. But yeah, that's sort of like my go-to for hydrogen methane or hydrogen sulfide. Right. And then so we talked about antibiotics, we talked about herbs, and now we talk about an option with elemental diet. So this is something hard to do. Not everyone can do it, but it's very effective for addressing SIBO. So research has shown that it has an effectiveness of 80 to 85%. And it basically consists on drinking a shake for 2 weeks, and patients cannot eat anything else. And it is a shake that will provide nutrients for your body, but it would starve off the bacteria. So they're pre-digested nutrients. They're absorbed super fast in our digestive tract that they barely get to our small intestine. So basically, the bacteria in the small intestine die off just from starvation. So very effective, but very hard to do because patients just drink that for 2 weeks straight. So there are some contraindications. Not everyone can do this, but research has showed that in about like 1 to 3 weeks, you can lower about 150 parts per million. So much more than what we can do with antibiotics or herbals in that period of time. So we can achieve this improvement with herbs or with antibiotics, but in a longer period of time. So it can be effective. They've tested it for hydrogen and methane SIBO, and it hasn't been tested yet for hydrogen sulfide for what I know so far, but it could be possibly effective for that too. But hydrogen and methane for sure.
Gosh, this one is a difficult diet. Have you ever had anybody actually complete it for 2
Yes.
weeks?
Yes.
Really?
I've had actually some patients that like it because they don't have to think about cooking or eating or getting their meals. So like it makes it easier. And also patients that don't like to take capsules because the herbs, one thing that I forgot to mention is that you take a lot of capsules. So sometimes it's about like 4 capsules per meal or something like that. So sometimes patients struggle with the amount of capsules and they just prefer to drink something along the way. But definitely patients lose weight and approximately in 2 weeks, like 10 pounds, like they lose when they're on the elemental diet. So definitely you want to make sure, like if you are a person that is already underweight or this always needs to be like very closely monitored with your like medical provider or nutrition provider. And also for patients that have uncontrolled diabetes or that they undergo dialysis or that they have eating disorders, this would be definitely contraindicated. They have very easily absorbable type of sugars, and that's why it's like not good for patients with diabetes. And yeah, and the cost is also something to take into consideration because it's definitely not a cheap approach either, but it is definitely very effective. So I've had patients that do really well on it and that totally resolve and help like clear their SIBO, and some other patients that tried it but couldn't like keep up with it for the 2 weeks, and then we just switched to a different type of treatment. And some other patients that don't even want to think about it, and they're like, that's off the table for sure. So yeah, they can. It's a interesting one. So that's for the elemental diet. And so now we'll talk about more about the low FODMAP or specialized carbohydrate diet that can go. This is more of a complementary part of the treatment, because it doesn't mean that you're like treating SIBO. If you're on a low FODMAP diet, you're mostly managing the symptoms. It is decreasing the amount. Basic FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. It's a very complex name just to say that it's a lot of different types of fibers that can be fermentable through the bacteria in our gut, and what I like to call in simple for my patients, just the bacteria's favorite food. So if we are removing the bacteria's favorite food, it's harder for them to continue growing and fermenting this and causing more gas and more discomfort. We don't want patients to be on a low FODMAP diet long term, because you are restricting good foods like cruciferous vegetables, things like cauliflower and cabbage, and broccoli you can only do in a limited amount, and avocado is high FODMAP, and cashews are high FODMAP. So a lot of good foods that are like higher FODMAPs that you're restricting. So you're also restricting good nutrients from your body. So you don't want to do this long term. You just want to do it while you're on a herbal treatment, for example, or to help you manage the symptoms while you're undergoing treatment. And the other category is a specific carbohydrate diet, which is what I like to say in simple, like the second favorite food for the bacteria. So if you want to be like super strict and just cut both of those off, it might help you feel better while you're treating, and it can help sort of not feed the good bacteria. So yeah, these are the two different categories. And I know you're all all the listeners are going to get the slides. It basically has the different categories. I definitely won't like mention all the foods that are low FODMAP, but you can see the different columns, like the greens are the lower FODMAP and red are the higher FODMAP. And it also depends on the quantity, because FODMAPs, like you might be able to tolerate a little bit of the FODMAPs at a time, but then if you do a lot, you're going to cause like a big fermentation, and that can be really uncomfortable for like the digestive tract. And all the quantities that are mentioned on the handouts are per meal. That's one thing to know. It's not per day, it's just per meal. So per sitting that you're eating something. And as I mentioned, not to do long term. Awesome. And this is just sort of the way that we like to explain how to balance a plate. And you can do this in general, but you can also do it choosing like low FODMAP foods, just basically having half of the plate non-starchy vegetables, a quarter of the plate protein, and then the other quarter dividing it in between complex carbohydrates and healthy fats. Okay. And then once you go through a full elimination of like you're doing a low FODMAP diet, so you're not eating a lot of FODMAPs, when you want to bring them back, you always want to do it slowly so that you don't overwhelm your system. And you want to go from like low to moderate and then moderate to high, just sort of like gradually reintroduce the FODMAPs. And you can definitely journal to track your symptoms and see if there's any particular foods that make it like trigger worsening of the symptoms. And there's some apps like CaraCare app that helps you track this experience as well. There's some like recipe resources that I'll leave here on the slides for you from different ideas that you can make on a low FODMAP diet, and different websites where you can find more recipes and options for you. So a lot of links and a lot of things that you can try if you want to try the low FODMAP diet. Awesome. And then, Jay, any questions before I move into like how to
No,
make
no, this is great. You've talked about recipes. You've given us some diet. This is awesome. Keep
great?
going.
Awesome. So the last part of this presentation is basically mentioning how we can stay like off, like make sure that we keep SIBO away and that we prevent reoccurrence. So we want to make sure that we have proper motility since we talk about that being a big root cause for SIBO. So ways that we can improve our gut motility is by staying active ourselves. So when we exercise and we move, it keeps our digestion also moving. If we're sitting a lot, it's definitely going to slow down our motility. So definitely we encourage patients, and I encourage your listeners, if you're having slow motility, to definitely move your body as much as possible. And you can also, if you have a history of any abdominal trauma, and or surgeries to in the abdominal area, even if it's a C-section, you can see a myofascial release therapist to work on any adhesions or to work on the ileocecal valve just to help things move properly in the digestive tract. This is something that has been very helpful for a lot of my patients as well. And there's certain nutrients like ginger is sort of the number one nutrient or natural thing that we think of for motility that you can do with food or with teas or juicing ginger, or you can do a supplement with ginger. And you want to try to do it in between meals because that's when our motility, the migratory motor complex, is going to be activated. So ginger in between meals or other prokinetic supplements like iberogast is another example, but there's a lot of supplements out there that can help your motility. And definitely supporting your thyroid. So checking with your medical provider if you have low thyroid, definitely addressing low thyroid as well to support motility. And yeah, as I was mentioning, the migrating motor complex. So this is our like stagnant swamp representing the small intestine when things are not moving and just a lot of things growing there. So we want to prevent this with like the movement and the myofascial release, and also by supporting the vagus nerve. So we can do meal spacing, which means not eating, like leaving a window of 3 to 4 hours, at least 3 to 4 hours between meals, and 12 hours if you can overnight, because that's going to repeat the process multiple times throughout the night. So if we leave 12 hours without eating between the last thing that we eat at night and the first thing that we eat in the morning, we're allowing our body to go through 4 cycles of this migrating motor complex and just cleaning up our gut throughout the night. So that's definitely encouraged. Drinking or eating or drinking ginger or ginger tea. And then vagus nerve stimulation exercises like deep breathing. It's a great way to stimulate the vagus nerve, which is the nerve that is going to make sure that we contract our gut properly. Gargling or humming or singing, something that creates vibration around our throat, is a good way to do it. Regular movement, like I mentioned already. And also chewing. It's so important. I know we all know this, but it's a good reminder to just chew our food properly. And that would stimulate the production of digestive enzymes and stomach acid and just helps to break down food better so that it doesn't, those big pieces don't get to our small intestine and then get fermented there. So chewing, very, very important. And let's see what else and the stomach acid, of course, like making that barrier of protection that we have there to kill off bacteria. So we can stimulate our stomach acid with things like diluted apple cider vinegar. We always want to dilute the apple cider vinegar or digestive bitters. And there's way to test if your stomach acid is good, and you can test this at home just by using baking soda. So you can mix 1/4 teaspoon with baking soda in 6 ounces of lukewarm water, and you drink it on an empty stomach. And then basically you just time yourself and see how long it takes you to burp. Normal time would be 2 to 3 minutes, but if nothing happens after 5 minutes, it might indicate low stomach acid. and we need the stomach acid for digestion and to protect us from bacteria coming in. So you can drink some, if you don't have a history of gastritis or ulcers or anything like Barrett's esophagus or other things, you can try diluted apple cider vinegar, diluting a teaspoon of apple cider vinegar in about like half a glass of water, and having that prior to meals can help you to stimulate your stomach acid. There's other supplements that you can use, but definitely monitoring with your practitioner, like betaine HCl would be another option as well. And these, I'll just leave with some practical tips for feeling better, for constipation or abdominal discomfort. Definitely ginger tea, and I know I've mentioned, or warm water in the morning, or magnesium citrate can help move the bowels. That's good for both constipation and abdominal pain. And then for patients experiencing a lot of gas, we might use fennel tea, or chew fennel. That's very relieving for gas. Patients with diarrhea can benefit from charcoal. It can be very binding, and that's why it can help diarrhea. And abdominal pain can be helped by peppermint tea as well. And then just sort of different types of movement with yoga for digestion, walking, and just preventing being sitting for long extended periods of time. And there's also a great way to help both the symptoms and balance your nervous system to help you get better on the side of like rebalancing the nervous system for your gut to be working optimized. And this is a hypnotherapy app that is called Nerva. And it basically works through hypnotherapy audios to try to rebalance the nervous system in our gut and just rebalance how our whole digestion is working. So I do see that patients benefit a lot from this app. So I always highly recommend patients to try it if they can. And that would be all from my end. So happy if you have any other questions or any other thoughts, Jay, happy to dive deeper.
You know, one of the most interesting facts you mentioned was that 60 to 80% of the IBS patients have SIBO. Makes me wonder, do you get a lot of referrals from gastroenterologists, or do gastroenterologists know about SIBO, or do they accept SIBO? What are your thoughts on that?
Yes, that's actually a great question. So SIBO is definitely like a gray area. Some GI doctors do test for it and it's
Okay.
accepted, and some even test like in their office and recognize it. They typically just treat with antibiotics. They don't, I have rarely seen patients that have like a plan through their GI doctor that includes prokinetics and stimulating digestive enzymes, and that all, like, we look at it as a whole picture to try to make sure that we treat it and we prevent recurrence. But we don't necessarily, I don't see that we get a lot of referrals from GI doctors, but we do get patients that haven't been able to resolve their SIBO, that have been trying to work with different providers, and either like their primary cares or their GI doctors, and haven't really gotten results so far. So they're trying to explore more like functional medicine and other ways to treat it.
Well, Araceli, thank you very much for joining us today. I mean, you've shared a lot of in-depth information about SIBO with us. Now, how can someone reach out to you?
Yeah, so anyone can reach out to us through the CIH website. So
Okay.
Capital, if you Google Capital Integrative Health, if they want to join as patients, there's like a direct link as create new patient. And if they want to reach out to me directly through email, I can type it on the chat, cihealth.org. So it's basically Benavides@cih.org, and that's a way they can reach out to me directly. But if they want to reach out to join as patients, definitely through the website is the best way to get an appointment.
Well, I'll make sure to put the website, the slides, and your email address in the show notes.
Great.
And thank you, everyone, for tuning into the Compounding Center Connections podcast. We hope you found the information presented today to be helpful. If you have any comments or questions, please feel free to reach out to me at j@compoundingcenter.com. Subscribe to our YouTube channel and our podcast channel, The Compounding Center Connections, and stay tuned for future episodes.